I would like to sit down here and say it's going to get better, it's all roses and unicorn, but no. It's We're literally fighting an invisible enemy.
As many healthcare workers get praise from the government during the COVID-19 outbreak, workers at this private seniors residence in Côte des Neiges and DG are worried about catching the virus, exposing it to their families at home, and exposing the very residents they work with.
A lot of us come from different parts of Montreal, and we come to work, and there's always that chance that we can get it or we can give it.
Rukaya Amin Gonda works at Le Boulevard Seniors Residence for the last 3 years in administration, and although she says they've implemented the government's guidelines by washing their hands as soon as they enter the building, wear masks and gloves while working, many feel like they're caught in a catch-22. And it's not just auxiliary nurses, patient attendants, and staff in the laundry department. Everyone working in the building is feeling scared and confused.
Everybody, they're worried. Everybody. It's to the point where if you have a cold, you don't know, if it's the virus or if it's the common flu, you're scared to give it. And then after that, if you stay home and call in sick, now we're understaffed.
Over 500 long-term care facilities have at least one confirmed case of COVID-19 in the province, and the numbers continue to grow. Those 70 years and older make a large portion of the deaths in the province and in Canada so far. This population more at risk as they could already have respiratory problems and other underlying issues. The residence Rukaya works at Le Boulevard has around 100 employees working around the clock, and Rukaya says they're staying positive, but says that with a shortage of workers in the industry, many are working overtime.
We don't have enough workers. So some of them are doing double shifts, triple shifts, overnights. So all I could say is bon courage to all of them. And guys, stay at home.
People who work in private nursing homes will see a $4 hourly increase. On Thursday, Quebec announced $287 million total bonus for frontline healthcare workers who are in direct contact with the sick during the COVID-19 outbreak, and that people who work in private nursing homes, many who make a little more than minimum wage, would get an additional $4 per hour. But is that enough when they fear for the safety of their families, the people they are caring for, and their own lives?
Where do you draw that line of who really is an essential worker and who is not an essential worker?
In Montreal, Melina Giubilaro, City News.